All right. Welcome everyone to our November monthly news event, the fifth vital sign, advancing and integrating climate and health policy. My name is Alex. It is a pleasure to be with you today. A little bit more about what we do here. I am the publisher and editor of the Xylem, and we are a nonprofit news outlet. We report on everything you need to know to grow healthy and interconnected communities across the world. And that means we do a lot of global environmental and health coverage on these impacts and on disparities. I love to welcome you to this chat, and please feel free to introduce yourselves. Tell us a little bit about where you are, what you're working on. What brought you here. I'd love to start this conversation. So to give everyone a brief rundown of how this hour would go, I will do a brief introduction of why we had this talk, and we'll introduce our experts here, Doctors Julia Fine and Josh Ettinger, and they will give a short talk about the recent findings of their research paper, which you can find that's pinned in our chat, and you can download it and read it yourself. We will then have a guided discussion and a Q&A where you are welcome to ask any questions that you have with the research paper or broadly about the work that we as reporters or as academics do. Afterwards, I will send this recording to you and also the slides so you can have something as a reference. Everything that's being said here is on the record, so you can also use this for your reporting purposes if you're a reporter. So a little bit about why we think it was important to have this discussion. So earlier in the year, the Xylem published an article, The Fifth Vital Sign, How Atlanta Doctors, which is our hometown, are talking climate change with their patients. Our contributor, Alex Music, is unable to join us today because of a medical issue, but she provided some quotes about why this was important to her in the reporting process. So Alex learned about the work of the Mason Center for Climate Change Communication, which both of our guests are affiliated with, while attending a panel at a science journalism conference last year. And this brought her to look into solutions. So solutions about at the intersection of climate change action and also about public health action, and where doctors can become an intersection of this. So here Alex explains that, hey, she realized that a lot of people on the disengaged and skeptical and the climate beliefs trust their primary care doctors more than any other source. Could it be politicians or people they meet at church or people they see on the TV for information on climate change? And so this was important for us to have a sense of what people really think about this issue and what people are doing to have a conversation about it. So Alex also, I asked her, so what was something unexpected in the reporting process? So Alex told me that this was very interesting to her, where doctors are starting to learn communication techniques on how to frame important information and factual information to the patients they're talking to, depending on where they come from. This is where, as a reporter, I usually say, meeting people where they're at. And I think that's a common bedrock of any kind of communication, not just climate change communication. And so Alex Music talked with a lot of doctors that are affiliated with the Medical Society Consortium of Climate and Health, which is also supported by the George Mason Center for Climate Change Communication, and that helped her develop the story of this coverage in Atlanta. In this reporting that we did, we partnered with two news outlets. So there's the Atlanta Community Press Collective that examines power structures in the city of Atlanta and beyond. And we also collaborated with 285 South, which is the only English language newsroom in Atlanta that covers immigrants in our city and in our metro area. It was important for us to collaborate with them because it's important to understand how doctors in both private and public hospitals are responding to this, and also how immigrants are navigating climate crisis, both in their home countries and when they come to Atlanta, they're trying to build their own social circles and to build their information sources, how doctors can play a part in this. So for Alex, what's next about what she's going to write on is that she's going to look into climate activism among doctors. So, doctors have a lot of roles to play in their communities, apart from being a trusted source of information. They often have the resources to drive actions in policy or to drive discussions on how, the medical system, the public health system is being built. And so that is what Alex will be working on, and we're very excited to work with her to continue to do this important reporting. So now let me introduce our two guests again, Doctors Julia Fine and Josh Ettinger. They will be talking a little bit more about their new research paper, which is advancing and integrating climate and health policies in the United States. And I will turn the time over to them to talk about what's new, what's important, and what you can take away from it. Thank you.
Great. Well, thank you so much for the invitation, Alex. And yeah, let's dive right in. So, what do these two things have in common? And my hint for you is I'm not referring to the fact that both spin in circles. Next slide, please. They are both climate and health solutions. And this is something that's becoming an increasingly important area of research and communication, because when we talk about cycling, it is great for your health, but it is also great for the climate. And likewise, when we switch from fossil fuels to renewables like wind turbines, we not only act in the interest of climate change by reducing emissions, but we also reduce local air pollution, which is also super important for our health. Next slide, please. Now, this research project is all about this connection between climate and health solutions. And in particular, really, we looked at the policy level. And the question we wanted to explore, which we're about to tell you about, is how can we advance both climate policies and health policies at the same time? And what should that relationship between these policies look like? Next slide, please. Just to quickly introduce you to our team, the top 6 photos are from our center, the Center for Climate Change Communication at George Mason, as well as our colleagues Matto Mildenberger and Anthony Lazarowitz. And we also were really privileged as part of this project to work with partners across 5 other countries, which I'll tell you about in a moment. And I'll also note that this project was funded by the Wellcome Trust. Today, we're just going to be talking about the results from the US, but in the Q&A, we're happy to also discuss some of the international results that our collaborators found. Next slide, please. So our central research question, as I've already pointed out, was should climate policies and health policies be integrated? And if so, in what ways and how? We worked with teams beyond the US, including in Brazil, the Caribbean, Germany, Kenya, and the UK, and we all explored this question. It was conducted, as we point out here, during the winter and into spring of 2024. And that's important to note because that was during the last presidential administration. So things have obviously changed a lot since then. But I think there are still important lessons. So in particular, we looked at this question through 5 dimensions. We wanted to look at first, what is the current state of affairs? How integrated or disconnected are climate policies and health policies? Are climate people speaking with health people? Or are they completely siloed? We also wanted to ask stakeholders in the policy space, what do you see as the ideal relationship between these 2 policy sectors? And based on these ideals, what do you see as the barriers to what you would like to see as far as climate and health policies working together? What are the opportunities to bring them together? And most importantly, what are the strategies that advocates for climate and health can use to push these policies forward? Next slide, please. How did we do this? Well, we spoke to a lot of senior stakeholders, and this was replicated in all the countries. For the US, we spoke to 65 people. And as you can see, we spoke to very senior people in agencies in the White House, activists and advocates, congressional staff across the aisle, think tank employees, academics. And this also included people with expertise in health, with expertise in climate, and a bunch who had expertise really at that intersection and identified themselves as such. We also spoke with a few people who worked on related areas like extreme weather and disaster response. That's okay, next slide. So let's jump right into the findings. So first of all, at the time of the interviews, when we spoke with people, all these stakeholders generally agreed that climate and health policies are pretty disconnected in the US. The training, the research side, the policy making, the policy implementation, these things happen in separate bubbles most of the time. And climate and health folks are really not interacting at all that much. And some of them told us they even speak different languages and use different data sets. So it's quite difficult to have those interactions. And Julia will get into the barriers like that in a moment. There's also a lack of legislation specifically on climate and health. However, there were some bright spots. Progress was made during the Biden administration, in particular in these interagency working groups, such as working on extreme heat, to try to bring in different agencies on those. There were also initiatives that have unfortunately been since disbanded, such as the Office of Climate Change and Health Equity, other projects in the EPA and elsewhere. And we see that there are specific issue areas that are a bit easier entry points to try to bring climate and health together. Like I mentioned a moment ago, extreme weather and disaster response are particularly primed for bringing in those stakeholders. Next slide. Now, looking ahead, the stakeholders we spoke with said they felt quite strongly, in fact, that we need to bring climate and health policies more closely together. These issues are inherently linked. Climate change causes massive health problems, and as we pointed out in the beginning, climate solutions are health solutions. So if we want to maximize the policy success and the health benefits of climate policy and vice versa, we need to get these policies in better dialogue and working together, and that includes all these stakeholders on both sides. We did speak with some conservatives who actually had a slightly different take, and this is important to note because they felt, you know what, if you bring climate and health too close together, then it might actually increase polarization and make it harder to pass policies. Maybe there is some consensus around some health action, but if you bring in climate change, it might actually break that process. So it actually might be context specific, and it may be something to consider for how we work across the aisle on these issues. Now, when it comes to what it could look like for climate and health to work better in terms of setting specific policies, there was a particular importance on decarbonizing healthcare systems. There are massive emissions associated with our healthcare systems. And there's also a lot of opportunities around agriculture, like the Farm Bill, transport, housing. There are specific areas that are really, really well placed to bring climate and health experts together. And I'll turn it over to Julia to take the next slide. Just on mute, Julia, sorry.
Thanks for that. I get the fun job of telling you all of the problems that our analysis uncovered that stand in the way of climate and health policy integration and advancement. And keep in mind, these challenges were present even under the Biden administration, and many of them have become more significant now. So one really commonly mentioned issue was just a lack of funding, but we wanted to dig deeper than that and figure out why is it that funding was so scarce. And oftentimes people said, well, it's because Congress won't get behind this, and that's due to political polarization, and in particular, conservative opposition to climate policy as well as to health equity policy. Our participants also pointed out farsightedly that it's difficult to make lasting progress on this issue when the administration can change. Like, this is a complicated task that needs to go on in an uninterrupted way throughout administration changes, and it's really challenging to maintain momentum when we can see this kind of seesawing between different administration priorities. Participants also commented that there was low understanding of climate and health challenges, not just among policymakers, but also among professional communities and the public. One person pointed out that in particular, congressional staff are not hearing enough about climate and health. And he commented that as a congressional staff person, it's just really challenging to have the time to go out and keep up with the research. So they only know what people tell them. And that really highlights the need for more science advocacy around this topic. Next slide, please. Participants also commented that there was a lack of necessary data on the health harms of climate change and the economic costs that result from those, also on the health and economic benefits of climate solutions, and on the outcomes of existing interventions that could perhaps be scaled up if successful. They also commented that there were silos in federal agencies. This was ascribed to a variety of factors, including that what little interagency work there was sometimes done as sort of a side part to people's official duties, and therefore there was a lack of capacity. Sometimes people were really just doing this on a volunteer basis in their free time. And they also mentioned that there were some sort of administrative obstacles to sharing funding, just on the legal side, how that works, and also not wanting to seem to be sort of giving away your funding to another agency, because then you might get reduced funding for your agency in the future. So some competition there. Then they also commented that there are silos in professional communities. As Josh mentioned, there's different types of training, different perspectives, communication styles, and policy framework in the health space versus the climate space, and those can create interoperability challenges. And then they also pointed out that climate and health policy exists in the broader context of a very stressed health sector and a fraught climate policy space with, again, a lot of polarization. Next slide, please. Another barrier that participants mentioned was that our policymaking structures lend themselves to short time horizons because of election cycles. Politicians are incentivized to go for programs that can produce results very quickly, but they may be less keen to invest in programs that will be important but will bear fruit more slowly. And that includes, for instance, things like emergency preparedness that can take longer to do. And another challenge sort of around time that came up was the need to act quickly on climate and health issues that are urgent, but also to take time to have in-depth participation of impacted communities. And we could go into more depth on this. Personally, I think that those urgency and in-depth participation need not be at odds. There's actually an interesting study from MIT, I believe it is around permitting, that shows that involving communities earlier on can actually speed things up overall because it reduces the chance of time-consuming legal battles later. Then there's also a lack of political will that was an issue, in part because there's a perception that local climate mitigation won't resolve all possible health harms driven by climate in that region. So for instance, if my town is getting hit by massive hurricanes due to climate change, then getting all the town residents to drive electric vehicles is not really going to address that in the short term. There's also, therefore, a perception that climate action incurs local costs in exchange for global benefits, and that can be unappealing to voters, especially if there's resource shortages. However, our interviewees pointed out that climate solutions often do have local health benefits. A key example of this is reduced air pollution, which is very direct, very immediate. You replace fossil fuel infrastructure with clean energy, and you see really near-term improvement in local residents' health. Next slide, please. So now on to some opportunities for climate and health policy. Again, due to the shift in the administration between then and now, some of these may not be so relevant for the federal level anymore, but so I'd like to just keep these in mind for the state and local level. So one opportunity mentioned was that there was growing awareness, interest, and concern around climate and health issues. And again, that may be something we could still capitalize on at the state and local level. There is also emerging resources such as funding, information, and technologies, in part made available through the Inflation Reduction Act. There is the potential, and is the potential, for large healthcare cost savings, although some participants said more analyses are needed to really make this case and show just how much healthcare costs could be reduced by climate solutions in such a way that it would sort of pay for itself. Participants also mentioned a variety of different sector-specific opportunities in areas like agriculture, energy, trade, and transportation. So things like what could be put in the, at the time, upcoming farm bill, also various trade ideas such as like sanctions that could be imposed and so on. And then finally, they said that the president, that is at the time President Joe Biden, could do more through executive action. However, some participants pointed out that a shortcoming of executive action is it's easily done and easily undone, as opposed to congressional legislation, which could be more enduring. Next slide, please. And of course, being a communication center, we were really interested in how participants thought that we should be communicating around climate change and health. And one of their main recommendations in this area was that it's important to talk about how climate change is relevant to health, because climate change can seem like a polar bears and melting ice caps issue that just happens pretty far away in time and space. But thinking about that personal health relevance can help bring climate change closer to home, closer to people's immediate priorities. They also suggested that it's important to engage strategically with policymakers and build relationships. Josh and I actually did a kind of spin-off project. We did this whole scoping review on how to communicate with policymakers about climate and health. So if you're interested, we can send that resource as well. But a lot of what we were hearing from our participants resonated with the conclusions in that literature. The interviewees also suggested choosing trusted and effective advocacy messengers, such as health professionals. Again, we have other research confirming that health professionals are indeed highly trusted voices, not just to the general public, but also to policymakers. And so they could be really great climate messengers. Participants further mentioned that we don't just have to restrain ourselves to talking about the climate and health message. We can also build in the economic angle, because oftentimes that is persuasive to a variety of audiences. And finally, they suggested that it's important to tailor messaging to conservative audiences. Pretty much everyone agreed you need to tailor your messages to them. Where there was a difference of opinion was how to do so. So some participants felt that it's important to discuss equity and justice with conservatives in a really purposeful way, so as to acclimate them to those terms and to not make them like a scary sort of boogeyman. Other participants, however, felt that it's better to avoid the terms equity and justice when engaging conservatives, and to try and get at the same concepts with different language that isn't so tied to political identity. Next slide, please. Some other recommended strategies beyond communication were just the need to educate stakeholders about climate health links, so everyone really understands what's at stake and what could be achieved by climate health policy integration, to accelerate research on climate health impacts as well as solutions, to strengthen initiatives not just within agencies, but also across them through central coordination, for instance, through the executive branch, to further institutionalize climate and health initiatives within agencies to increase internal buy-in from agency staff, which would in turn make them potentially more robust to seesawing of the executive control, to seek more funding and to mobilize existing funds, to empower and elect climate and health policy champions, and finally, to overcome structural barriers through activism and advocacy. Next slide, please. So we also wanted to talk just briefly about how these results compare to the findings from our other partner nations or regions, because we do have the data from all of those at this point. And the overwhelming consensus across all of these regions, Brazil, the Caribbean, Germany, Kenya, and the UK, was that climate and health policy should be integrated. We heard this loud and clear from pretty much every interviewee. Now, in terms of the current state of integration in all of these areas, we found that there was relatively more policy integration going on in Germany, Kenya, and the UK. But in each of these geographies, they mentioned that, yeah, it sounds good on paper, but there's a lot of implementation barriers where maybe the policies are in place, but they don't really have teeth to them. They're not that enforceable, or there's just not enough capacity to enforce them. Some other common themes that came up in other countries but weren't mentioned in the US was a need for more skilled personnel, a need for national indicators, targets, and legal frameworks, and a need for multi-level governance that integrates state, local, national, and international. And in addition, participants outside the US tended to mention the importance of international deliberations such as the COP. Unsurprisingly, this came up a lot among Brazilian interviewees. Next slide. Now, it would be kind of not addressing the elephant in the room to not think through how these results relate to our current context, because so much has changed since we conducted this research. Of course, to state the obvious, our federal administration is now unsupportive, not just of climate action, but also of a lot of public health work that was going on previously. So in this context, we feel that state and local climate health policy becomes more important, more necessary than ever, because unfortunately, climate and health issues are not going to wait for us to figure out our federal situation. And we feel that this current moment highlights the importance, like our participants were saying, of creating strategies that will lead to lasting and long-term change, rather than maybe something that looks impressive but will only endure over a short time and then be undone by the next unsupportive administration. So this looks like potentially more durable policies done through Congress, not through executive action. And it potentially also looks like deep cultural shifts among the public, but also professional communities and policymakers, so everyone really understands the issue, because otherwise we're not going to be able to come together and address it if we don't even share the same reality. Finally, it highlights the importance of electing climate health champions and not getting so narrowly focused in our policy wonk world that we forget about electoral organizing and community organizing more broadly in order to obtain power in a system that we know does favor the interests of some groups over others. Next slide, please. So as for where this research stands now, the other national and regional findings from our partner nations and regions will be released in that same special issue where our article about the US was, in the Journal of Climate Change and Health, for which I'm actually serving as a guest editor, as it's Josh. The synthesis of the results is written up, currently under review, and we'll be happy to share that around once it is hopefully published. And if you want a seamless way to receive these updates, you can sign up for our mailing list at this QR code. We can leave that there for a while in case anyone wants to grab a screenshot. And then maybe we can move on to the next slide. All right, so that's all we've got for you, and we'll open it up for discussion.
Yeah, thank you so much again for Julia and Josh for taking this time to go through the study. There are a few things that I really want to add to it based on a reporter's lens, right? So I think we appropriately chose our webinar the day after Election Day. So I am based in Atlanta, which we had elections, and George Mason University is based in Northern Virginia, which also had statewide elections. And what we see were very dramatic results, to put it lightly. Georgia is usually a competitive state, but then the state elected 2 Democrats who defeated Republican incumbents as public service commissioners by a margin of over 20 points. That is something that Democrats have not won a single statewide race that is not the Senate since 2006. So that is a notable change that has happened. And so in Virginia, the Virginia governor is term limited. He's a Republican, but then his lieutenant governor ran to succeed him, but was defeated by a double-digit margin. There appears to be a changing of hands of, around 14 seats out of 100 in the Virginia General Assembly, which also means Democrats have secured a supermajority for the first time since 1991. I was born in 2000, so which means I was not alive to see any of those things happen before. So this is uncharted territory even for myself as a journalist. I had the opportunity last night to talk with Peter Hubbard, who was one of the winning candidates of the Public Service Commission. So he told me 3 things that he really cared about was 1, lowering power bills. And the way that he thinks that power bills can be lowered is to have more negotiating power with Georgia Power, which is a monopoly on our state. The Xylem has done some reporting about how negotiating power has ebbed and flowed throughout the years, and how power bills of consumers have really increased. And Peter said that he thinks that that could be something that he could have bargaining power on. The second thing he says is data centers. That's a very controversial issue across the US. And the third thing that he actually talked to us about was, wow, public health is a priority for him as well. So he's thinking about how he can push for integrating climate and public health policy by holding utilities accountable. And in Virginia's case, right, the outgoing Virginia governor attempted to withdraw the state from a compact between a bunch of northeastern and mid-Atlantic states to measure climate impacts and to achieve climate-free electricity, but that was blocked by a judge. And the judge said at a time that it required the consent of the state legislature to make any decision on whether to join or leave such compacts. So in this case, right, so this election result pretty much secures a Democratic trifecta in Virginia, which also means it is highly likely that Virginia continues to be in the compact. And before I start reading questions from the audience, I see there are some questions in the chat. I just want to make sure that I mention here that the Xylem is a reader funded publication. We are also a nonprofit, just like the George Mason Center for Climate Communications. So your support is really important to keep events like these going. So interested folks, academics, journalists, policymakers, and experts can come together and discuss about issues that can really make a difference in people's lives. And so we are having a year-end fundraiser called Newsmatch. So if you give $1 right now, it will get triple match, which means we will get $4. So if you would like to support more events like these, please feel free to scan this QR code. I will put it on the chat later. So to support more events like these, and we hope to do monthly events like this heading into 2026. So let's look at some questions, right? So the first question from Noella, thank you. So Noella says, thank you so much for the presenters to share your findings and analysis. The first question is, what are some specific information of how climate information is finding people in policy and health sectors? Noella is interested to know what is currently working and how that might be built upon. Any one of you want to take this question first?
I can kick it off. There were a variety of different mechanisms, but the one that really jumped out to me that came up in discussions among especially the health world is the importance of, in medical schools and in training of health professionals, like bringing in the climate information as they prepare to enter the field is absolutely crucial, and having climate experts give presentations, climate and health experts. And there is, as far as we can tell, especially through our consortium, that a growing effort across medical schools to make this really standard training. Maybe Julia, do you have other examples?
Yeah, for the policy space, just in case anyone is not familiar with it, I wanted to give a shout out to the Medical Society Consortium on Climate and Health that the consortium was just mentioning. We work with them a lot at our center, and it's this really awesome network of health professionals. And one of the main things they do is advocacy at the state and national level, I believe, possibly locally as well. So they have like a lot of shared expertise about how to frame climate change when engaging in the advocacy and how to use their voices to push the important climate messages to policymakers. Yeah, I'm sure there's other advocacy organizations doing that, but that's just the one I happen to be most familiar with in the health space.
Yeah, thank you both Julie and Josh. I think Noella has a second question. I'll wait for her to type up the question. And as you just saw right now, that's my cat. His name is Hudson. He is our newsroom's unofficial mascot. So, help me say hi to him. He really loves attending news events like these. So please help us keep this going. And so I have a question for our panelists. My question is, has your study found or not found a link between a top-down or bottom-up governance or decision-making system with the integration of climate and health policy? As in, do we see if there's more bottom-up involvement in policy making, or versus technocrats making decisions in elected or unelected positions? Has that affected the pace of integrating or advancing climate and health policy?
Mm-hmm. I don't know about the pace. I do remember some interviewees talking about the need for engaging affected communities in decision making. Some participants possibly outside the US even, were talking about things like citizens councils as mechanisms for climate and health decision making. And then we had that one concern that we shared about, well, maybe that's time consuming and how do we move quickly, but also do things well in an inclusive way. So yeah, I think that's the main thing about PACE that came up related to that.
Yeah, I think it was both approaches were definitely mentioned. The importance of leadership from the top down, setting that standard to drive climate and health policy action. That said, a variety of people also mentioned the importance of grassroots efforts as well, and especially putting, grassroots activism and advocacy, putting pressure on policymakers to prioritize these issues.
All right. This is question 2 from Noella. Julia mentioned culture shifts among the public, professional communities, and policymakers that may be barriers to making significant changes to climate and health policies. Would you please give some specific examples of some of these culture shifts and culture changes that have been happening?
So I think we might have gotten our wires crossed a little bit. I think we're bringing up culture shifts in the sense of we need culture shifts so that people really understand that there is a relevance of climate to health and vice versa, and also a culture of acknowledging the importance of preparedness for disasters ahead of time rather than always kind of playing catch up. So more sort of proactive climate health policy action. But actually, I think we could speak a little bit to your question as written, which is there have definitely been some cultural shifts away from the direction we were hoping that would happen in the interim. Josh and I have done some work on nationally representative survey data that shows Americans' trust in health sources, perception of climate health issues. But again, that was from pre the current administration. So I think we can just sort of speak as to our personal perceptions at this point of what's going on. But I would definitely say like the rise of the MAHA movement is concerning. The sort of erosion in public health agencies overall is concerning. Because it seems like at the time we were doing this research, there was a lot of mistrust and political polarization around climate, but the health mistrust was a little bit more narrowly focused on COVID and vaccines, and now it seems to be spreading to quite a few other areas. So that is concerning because we can't do the climate component without the health component and vice versa, and we thought at the time that health could be pretty depolarizing for climate, and now it's like a little bit less clear, I think, at the federal level at least. Yeah, but for cultural shifts that we want to see, deepen knowledge of climate and health, just like broad acceptance of the scientific consensus, not just that climate change is happening in human cause, but that it has profound health implications would be a great starting point. Josh, anything you want to add to that?
Yeah, just among the professional communities, right? To give a specific example, doctors, health professionals not only should be talking about climate change in their practice and with their patients because this is an important issue, but because it directly affects many of their patients' health, especially vulnerable populations, elderly, babies, children, in particular, people with pre-existing conditions. And that requires an engagement of the health community with the climate community to work together to map out these impacts, future projections of impacts, and also the solutions. So it's really cultural communities of really reaching across beyond your discipline to help map out these different areas.
Thank you so much for both of your answers. And I want to make sure our audiences get this resource. This is produced by the Yale Program on Climate Change Communication, who is also a partner of a lot of the work that we do. A lot of our reporting, we source from experts that look into the issue. And one of the, keystone projects that the Yale Program on Climate Change Communication does is Global Warming's 6 Americas. So they ask a few questions about people living in different parts of the world. So this is 6 Americas, but it could be 6 Indias, it could be 6 Brazils, it could be 6 Chinas, to that far. And what we can see just within the past 10 years, right? The number of people, who have different beliefs about climate change, it's not neatly on a binary scale, which is like, oh, do people accept climate change or not accept climate change? That's not how necessarily it works. Instead, people can be roughly divided into 6 different chunks. So there's alarmed, concerned, cautious, disengaged, doubtful, and dismissive. And these chunks are not equal in size. This is important to know. Within the past 10 years, the number of people who are alarmed has went from 15%, which is 1 out of 6 people, to 26%, which is more than 1 in 4 people. The number of people who are concerned and cautious have slightly decreased, so it appears that they have moved towards a more alarmed situation, while people who are disengaged, doubtful, and dismissive are, they're roughly around like 25 to 30% total combined. It's pretty constant, but that doesn't mean that they get, there are not ways to engage with them to evaluate how they can work with climate action, or work with or talk to reporters and to still support climate action from a policy level, or public health action on a policy level, despite some of their misgivings about climate change. Another thing that's really also important is that while people's acceptance of climate change is an important gauge to measure, also what people's acceptance of public health principles are something that can be measured, that does not neatly translate into their policy support in terms of what they vote for from day to day. There are some people who have doubts about an issue that they still vote for it because of other practical concerns, and sometimes people put priorities on other things that might lead them to prioritize other things first and not vote for certain policies. So that's something to put out there to make sure that all of us get to be on the same page. So the final follow-up question from Noella is, are there any good public examples, emphasis on public, that either of our guests today have seen that really communicates well the climate health nexus?
So I was initially trying to think if there's any really good books or documentaries along these lines. I'm kind of drawing a blank on that. Certainly there doesn't seem to be anything as high profile as like an Inconvenient Truth or Don't Look Up. And maybe that's an opportunity space as well. In terms of what I have seen, I'd say a lot of climate advocacy organizations are already framing climate change in terms of health in ways that could be really effective. Like for instance, I'm in the Chesapeake Climate Action Network, and my friend, whenever he's giving sort of his spiel about how he got motivated to participate in climate change advocacy, he talks about having to put masks on his 2 young daughters on the way to school to protect them from inhaling the air pollution from the wildfires that came down all the way from Canada. So I think that kind of personal story with sensory details about the health impacts of climate change can be really persuasive. Josh, are you thinking of any other, or am I missing anything, public examples of this?
Well, I think the consortium we mentioned earlier has a variety of materials which I think are quite good. But overall, I think this climate and health link is a massive missed communication opportunity that the climate and health communities should be emphasizing this link more. And we also know from our other research from our center and with our Yale colleagues that health professionals are among the most trusted climate messengers. So the more health professionals that speak out, I think the stronger receptions they'll have. There are some good advertisements from the group Potential Energy as well, and then they do some great things as well. And hopefully we'll see some more climate and health messages from all sorts of different people soon.
Yeah, I will hop onto that because that's sort of part of my job as a reporter, right? So as I cover the health impacts of environmental and climate justice, everything from oil spills to air pollution because of fossil fuel extraction and export industry, to the Cop City movement in Atlanta in the past. Also transit, I've done a little bit of that before. So there are climate, for myself, climate change is an everything story. So it takes a lot of care to draw the ties together, and health is also an everything story, and people are really concerned about living in healthy spaces, right? So we do a lot of reporting at this intersection. One source that I would love to highlight is a meeting, a webinar that was held yesterday, actually, by Covering Climate Now, which the Xylem is a member newsroom of. So the Covering Climate Now consortium is a few hundred newsrooms across the world that works together to cover the climate right now, which is what it does. And yesterday they convened a group of experts, which includes, Catherine Hayhoe, who's, the chief scientist at the Nature Conservancy, Daniel Swain, and I think there's also a professor from California, and also Dr. Kim Cobb at the Institute for Environment and Society at Brown University. Disclaimer, I did used to intern as a student for Dr. Cobb. That's a disclaimer. But then they came together to discuss this memo that Bill Gates, who a famous billionaire, has put out ahead of COP30, just last week. So in this memo that, that Bill Gates put out, some of the key points he said was like, well, climate change is serious, but we've made progress, but we can't cut funding for health and development programs. So what the experts said in this case was that from the summary of this video that you can go watch yourself, Bill Gates has the facts right, but the framing was wrong. As in, one way that Dr. Catherine Hayhoe has put out was that climate change is an issue that amplifies health impacts. Right? So that's why if you're trying to solve health issues, you cannot neglect climate issues, because letting climate crisis get worse means that the public health crisis also gets worse. There are many ways how you can, communicate this climate health nexus. For example, some common ones that we as reporters we dealt with is that pathogens or insects or parasites can move further and can move at different times of the year because it's warm. So they can go to a new place and affect people who are susceptible to it, who have never seen this kind of parasite or disease before. That's one thing. Another thing that we've recently covered is about health and extreme heat and climate change. So in the state of Texas, which it's a big state, very warm, very humid, especially in the Gulf Coast. There's a recent study that worked with people who have survived burn injuries. So their skin is burned, that's why they can't sweat, on figuring out a system to let them know when it's safe for them to go outside without getting a heat stroke. So that is sort of what we call a adaptation or resilience part of climate strategy. But researchers have got a funding to put a second stage of the study towards construction workers. There are a lot of barriers to that, because while they have survived the recent Trump funding cuts, there's no telling whether there will be another round of funding cuts that might affect this research project. On the other hand, the Texas state government recently passed a law which was upheld by the courts that essentially prohibited local municipalities, which are democratic controlled, from requiring water breaks for construction workers if they're outside in the heat for too long. So that is a health and climate issue, because Texas it's getting more and more hot, more and more humid. It's oftentimes not safe for people to do physical activity for extended periods of time, even if they're healthy, able-bodied, going around. And and that's not even to mention people with disabilities or people with health issues. So these are usually some of the things that we try to cover and try to make a difference. That's sort of where I jumped in, and it's important for us to really tell both sides of the same story, with accuracy and with context. Yeah. Let's see, are there any more questions from the audience? Okay, so it doesn't seem like it seems like we have answered all the questions. So I want to give the final word to both Julia and Josh. If there's one thing that participants who are in here or is rewatching a recording of this seminar, that one thing that they need to know and take away from in one sentence, what would that be for you?
I would say probably that there's an overwhelming consensus among experts that combining climate and health policy is beneficial. And even though some avenues are closed off to us right now, many others are still open depending on the state and local context, as well as internationally.
Yeah, and I would add that one of the most powerful yet underrated things you can do for climate change and health is to speak with your family and friends. It is such an underrated action and such an important way of driving change. If you approach people you know and have, candid and trusting conversations, it can go a long way.
All right. Thank you so much again for Julia and Josh being part of today's news event. Again, you can subscribe to the Asylum's newsletter. We will provide you weekly updates on everything you need to know about, environmental and health disparities across the world. And, stay tuned for the next news event, which we will announce very shortly. And we hope that you have a great rest of the day. Thank you so much, everyone.
Thank you.
Bye.